Okay, we are live. So, hello everyone. Today we're talking about brain health with medical doctor, Dr. Charles Hebert. He is actually medical director at Emergency Psychiatric Services, and he's visiting associate professor at the University of Colorado. So, first, thank you so much for being with us and for your time. And the first question first of all, I have to start how I actually find Dr. Charles. He actually wrote an amazing article at at the very popular magazine called Psychiatry today. And his article was about how brain health is actually connected to the climate change. And I think the entire idea of the link between the climate change and brain health is absolutely fascinating, and we definitely deserve of our attention, and we're going to discuss about it today. So thank you so much for being with us, Dr. Charles.
Thank you for having me as well.
So the first question is, what is so special about the link between the climate and the brain health?
Well, we know that in my line of work in psychiatry, we consider many of our mental illnesses to be an aspect of brain disease. We know that they have a neurologic signature in the brain. And so it's increasingly clear that neuroscience and some neuroscientific abnormalities are kind of what controls or what compels psychiatric illnesses. And so the link between brain health and climate change is starting to become more apparent. I think what we notice is that as climate change advances and we see increasing storms, hurricanes, a lot of the media reports that floods, or where I am in my area of the country, in Colorado, wildfires, it leads to a lot of mental stress and upheaval. And so we see a greater incidence of psychiatric disorders following those sorts of events. And a lot of it, I think, actually has to do, in part at least, with the fact that a lot of those events result in forced displacement of people from their homes, from their sources of social support, and that engenders a lot of likelihood of mental illness, which we know has a brain signature.
It's very interesting. So I actually met a lot of absolutely new terms for me in this article. What does it mean? What actually means the eco anxiety?
Yeah, eco-anxiety is, broadly speaking, sort of a term that describes the mental duress or distress. And I say it that way because it's not necessarily going to result in a mental illness. So by itself, eco-anxiety does not portend mental illness, but it's the stress or duress that a person or their brain, like you mentioned, comes under because of some kind of environmental catastrophe or some kind of ecological crisis, like the things we've been discussing already: wildfires, floods, massive storms, those sorts of experiences.
But when people actually experiencing some sort of stressful situations, does it actually mean that it's a mental condition? Like how we cannot. So the question is, how can we actually identify that it's actually a mental condition? Because people can be just stress is a norm often for our life. So, but for some people, they're more sensitive to a different type of stress. So how would you describe, how can we identify when, some sort of stress, especially climate, connected to sort of, internal environmental, things. So how can we identify a mental condition? How can we say that there's some sort of something is going on with our relative or with someone, and that's actually mental health related?
Yeah, I wish there were a definite rubric or a questionnaire for this or something like that, but there isn't. In psychiatry, what we have is our interview, our clinical interview. There are some sort of signposts for that.
Mhm.
So like you're saying, there are, for a number of reasons, either related to climate change or something else in a person's personal life, there are a number of reasons people can be stressed.
Mhm.
And feel acutely in real time like something is stressful and impactful to them, but then they recover in short order, right?
Yes.
Where something becomes a psychiatric illness or a mental illness in our field is when it really starts to inhibit functioning. So what we have our eye towards are people who don't bounce back, who stay persistently stressed, and then start to experience problems with their functioning, either in interpersonal world, so their relationships with other people start to suffer. It could be with our occupational world. For many people, that may mean school, but for those who are employed, it means that they can't maintain their obligations in the workplace, or even personally, that they start neglecting themselves, not even taking care of themselves. They may come away from eating as much, or actually not get outdoors as much anymore. And I've seen that happen with some people who have some climate related anxiety. They may not actually shower regularly or get adequate sleep. So your question about actually how do we identify that comes, of course, actually by talking to the person. And in clinical practice in the emergency department, that's what I do, is I do a clinical interview. But if you're not trained in mental health, you can still look for some of those warning signs. And the ones that I usually point to are sleep loss. When people lose sleep repeatedly, it's
Mhm.
usually, or not always, but sometimes a good indicator that something about their behavior or their mood, a climate-related mental illness might be starting to take hold. The other big one that I've seen in our practice is, in order to manage the anxiety or manage the mood changes, some people get more, have a higher frequency of substance use. That could be alcohol, it could be something else, but alcohol is pretty common. And so I think that's something that's really observable to someone else, who's a relative or a friend, even without mental health training. If you see people investing more in substance use, that might be an indication that someone needs care.
That's very interesting. So, and the thing is, how can we, in a polite way, how we can actually ask for help? How can we help to those people themselves in this situation? So, if, for example, some behavioral change been noticed, identified, what is the next step? What can
Yeah.
be
So I think one of the challenges here is, as we've already talked about, is if it is a climate related concern, and we know
done?
from the literature and the research on this that it's pretty prevalent. In the article that you were describing, I talked about some papers that addressed the aftermath of Hurricane Harvey so many years ago in Houston, Texas, and how there was a good proportion of people that actually met criteria for PTSD related illnesses afterwards. So if it is related to climate change, I actually think we don't have full momentum on that in the behavioral health or mental health world to sort of get people the care that they need. But
Mhm.
one way to actually seek care is to go to community mental health centers. If you don't have, say, a practicing doctor that you're working with, a
Mhm.
primary care provider who can provide you with a referral, um, county mental health centers or departments of public health, almost all of them are required in some capacity by regulations to have an emergency operations plan for disasters. And part of that disaster plan is that they must fold in behavioral health. I used to do some of this work previously before I relocated to Colorado.
Mhm.
And many of those state and county medical boards or departments of public health will actually have psychologists on hand, or can at least connect you with the resources in the community that might be able to help that loved one.
It's very interesting. So, so basically, are they obligated? Like, for example, Kaiser Permanente, do they have it at Kaiser?
I can't speak to Kaiser personally because it's not part of the group that I work with,
And
but I will tell you they are tasked, same as most big institutions are, with having an emergency operations plan that actually follows from a regulatory standpoint what FEMA advises. And in order to actually get, after a mass disaster, a climate crisis, a hurricane, some of the things we talked about here, in order to get some of the appropriations for recovery, their plan, same as in many institutions, actually has to follow certain FEMA-related guidelines. So without knowing specifically about Kaiser, I couldn't say with certainty, but that traction to have an emergency operations plan that includes behavioral health disaster
Mhm.
planning, that traction is growing across the country.
It's growing. That's honestly, it's very interesting because I didn't know about it. I'm sure a lot of listeners, they had no idea about the existence of this. So literally, how can we find those medical centers? Are they available online? Are they available, like, do we have to have specific insurance or whatever, or they can accept anyone?
No, at the county level, all of this is publicly available. Whether or not each county or each, like I said, public health community can actually have those resources for everybody in the population that they serve, that's different from one place geographically to the next. I previously worked in Chicago before relocating to Colorado, and there we had a lot of private partnerships with other community mental health organizations. So it may not be something that's fully staffed by public health officials, but they usually have connections in the community where you can actually find some of those. The best place to start, typically, I would say, actually is with your county public health department. And they usually have an online website where you could find those contacts and resources.
That's good. It's very good to know. So another question is, in your article you mentioned one of the most common consequences of the climate change is actually stroke. It was a really good number. It's a big, it means saying that the entire idea that our climate get a lot warmer. A lot of people, especially older one, they can experience such thing as stroke. And I know it's very hard to identify. It's very hard to, sometimes it happened absolutely unnoticed, and people have consequences afterwards. After several years, they somehow on MRI or somehow they can see eventually that something happened to them, like stroke. But it's very hard. It's very dangerous condition, but it's very hard to identify. Can you please, because you have a lot of experience, can you please explain how can we identify the stroke and how can we help someone who is experiencing?
Yes. I think I'm glad that you addressed that, because most of what we've been talking about is ecological catastrophes like floods, hurricanes, etc. It doesn't have to be something on that order of magnitude in order for climate change to have an impact on brain health. So heat, like you're bringing up, is a big one, which can contribute to strokes. There's research on that. In people who have neurodegenerative diseases already, or maybe have already suffered a stroke, who may have dementia, we know, for instance, that those patients actually are more likely to be hospitalized as ambient air temperature changes. As the brain ages, it loses some of its capacity for thermoregulation and to maintain its own internal body temperature for the body. So if you're in a setting where there is a lot of ambient heat and temperatures are rising, those folks, or those individuals who already have advanced age or have had some past structural brain disease, are going to be more at risk. How to find it, particularly a stroke, the big sort of telltale warning signs of a stroke are typically actually things like a facial droop. So if you were to ask somebody to smile, you would see actually it's asymmetric as compared to their left and right side. That usually, as you can imagine, means that their speech may be off. And so it will come across as being inarticulate, or they may be mumbling, or they may even actually, when they speak, be speaking nonsensically, almost as though the syntax of their sentences doesn't make sense. And then the other big one that's usually suggestive of possible stroke actually is motor loss of function. So inability to move an arm or a leg. Those are kind of the classic warning signs that really should make people pay attention. But I think you raise a good point that there are other aspects of brain health or brain disease where a stroke could occur that are more in what we would say are silent areas of the brain. They don't control motor function. They may not control speech, but an event may still be evident. And sometimes, believe it or not, that presents with very little warning signs in advance, sort of like the cases you're describing. That may be a person just being altered or sort of disoriented, which may not be a full stroke that results in damage you could see on an MRI, but it could be heat stroke. And regardless of what that might be, it's still something that merits prompt attention.
So is it any way to prevent?
Well, one thing that I would advise actually in terms of preventing some of the things that we're talking about is to back up a second actually in terms of the disaster piece itself and kind of how people are forcibly displaced is you have to have a plan. And so when there's reason to think actually that you possibly, if you live on the Gulf Coast, let's say, are going to be displaced by a hurricane during the season, one way that we can support our loved ones is to make sure they have an evacuation strategy, make sure that they actually have adequate food, adequate water, the sorts of things that are responsible for maintaining brain health, so that when the event hits, which is the worst time to start planning, but when the event hits, you already have a plan that you can execute. And there are guidelines for this online too at places like ready.gov, which is one of FEMA's and the government's websites that will tell you how to actually prepare for an event, so that if you are forced to be displaced, if you are forced to get away from the heat, you have what you need in order to actually maintain your brain health. That's the best advice I can give in terms of prevention. And then the other one that I would say to go along with that is just make certain that the other causes of stroke are well tended to. So we're talking about heat, we're talking about ecological crises, but certainly smoking, high blood pressure, diabetes, things like that can contribute to stroke on their own. And you don't want that as a double hit when a climate disaster also happens.
So the basic, like, taking care of yourself and some sort of people in a better health condition, they have less chances, right?
We would hope so, yeah.
Okay, that's actually really good to know. Also, I have a question related to COVID. Is it true that people who experienced COVID, who had COVID, actually have high chances to have a stroke?
Well, I would say that we're seeing increasingly, at least in the early part of the pandemic, when I was doing some of this work back in Chicago, we know that COVID actually created a state of hypercoagulability, our way of saying that people were more prone to blood clots. And some of those actually could cause disorders like a stroke if blood to the brain was impeded, for instance, by that clot. Since then, I think we're seeing still a great deal of new data that's coming out that talks about the neuropsychiatric consequences of having had COVID. Some of that actually has produced a lot of findings that suggest there are some long-term neurological consequences. And in psychiatry, actually, we've seen some instances in which the brain responds with what we call a state of catatonia, a different kind of disorder of brain health. So yes, I think some of that data exists. I don't know how prevalent it is after years of having had COVID, though.
Okay, that was very interesting. A lot of information. Thank you so much for your time.
You're welcome.